Good afternoon, everyone. We are here with the case study presentation on diabetes mellitus. Myself Smritika, and I will be presenting case study 1, followed by 2 Sai Darshini, 3 Prasanna Kumar, 4 Sneha AT, followed by 5 Shweta TJ and 6 Venkateshan. Diabetes mellitus, a real case study. These are the contents. Introduction on diabetes mellitus, its causes and types, followed by subjective data and objective data of patients, like patients' demographics, past medical and medication history, general examinations, screening and complication of diabetes, followed by treatment and diet schedule, advice and care plan. Introduction. Diabetes mellitus is a group of metabolic disorders which results in high blood glucose level for a long period, resulting from defect in insulin production, insulin action, or both. Recent view on the occurrence has shown that about more than 4.7 million people suffering from diabetes. Diabetes symptoms are excessive thirst, frequent urination, sweating, blurred vision, sudden weight loss, fatigue, and slow healing sores. Most patients with diabetes suffer from polydipsia, that is excessive thirst, polyphagia, excessive eating, and polyuria, frequent urination. Diabetes is majorly of 3 types, that is type 1, which is due to absolute deficiency of insulin, type 2 due to relative deficiency of insulin, and gestational diabetes. Gestational diabetes only occur during pregnancy. Hormonal changes influence insulin, which causes ineffective insulin production, resulting in raised blood glucose level, and that high glucose level affects embryo. Types of diabetes mellitus, type 1 and type 2. Type 1 is due to pancreatic failure to produce enough insulin due to loss of beta cells. In type 2, insulin resistance contributes to high glucose level in the blood. These are the subjective and objective data of the patient. Subjective data: name, sex, date of birth, followed by age, height, weight. Complications of patients like frequent urination was there, blurred visions was absent, loss of weight was there, and hypertension was there. Objective data: past medical history of patients like diabetes mellitus and gout. Recently medical history: left hand fractures followed by bradycardia, that is slow heart rate. Social history: blood pressure slightly high, that is 142/80 mmHg, pulse rate little less due to bradycardia, and temperature was normal. Sugar range of patients was: fasting average 180 to 200 mg/dl, and postprandial was 200 and plus mg/dl. Symptoms and assessment: based on the signs and symptoms, subjective or objective data, the patient is assessed to be suffering from diabetes mellitus and gout. Gout is a condition in which uric acid builds up in the blood, causes hyperuricemia. Screening and complications of diabetes. First of all, screening of eyes was taken. Retinal examination did not reveal any hemorrhage, exudates, or diabetic retinopathy. Nerves screening: no significant evidence on sensory or automatic neuropathy. Blood pressure was hypertensive. ECG bradycardia detected. Treatment and diet schedule. Treatment in medicine: metformin and glimepiride 1000 mg and 2 mg was for diabetes, and gout medicines was allopurinol 200 mg, prednisone 5 mg, and donica 50 mg only at morning. Diet schedule: breakfast between 7 to 9 am, 2 idli, dosa or chapati. Lunch: the patient should take lunch between 12 to 2 pm, 1 bowl of rice followed by veggies. Evening 5 to 6 pm, tea and snacks, that is biscuit. Night 7 to 8 pm, the patient should take 2 idli, dosas or chapatis. This is advice and care plan. Light exercise should be followed. Maintained diet. Avoid sugar. Use sugar-free product. Patient should avoid protein-rich food since he have gout. Limit caffeine intake. Drinking alcohol builds up uric acid crystals, so drinking alcohol should be avoided. Drink plenty of water. Take enough rest and sleep. Prescribed medication should be followed. Thank you.
A very good afternoon to everyone. I am here to present case study on the topic diabetes mellitus. Let's move on to the topic. So we all know what diabetes mellitus is. It's nothing but a chronic metabolic disease characterized by elevated levels of blood glucose or blood sugar, which leads over time to serious damage of the heart, blood vessels, eyes, kidneys and nerves. So we know the types of diabetes mellitus: type 1, 2 and gestational. I am here to concentrate more on gestational diabetes mellitus. So gestational diabetes mellitus is nothing but it is a diabetes that develops during pregnancy. The exact cause of gestational diabetes mellitus is not known. Even the doctors are confused why some pregnant women develop gestational diabetes mellitus and others don't. But the most likely cause is mainly due to the hormones. So hormones play a major role in our lives from age to age. So during pregnancy, the woman undergoes major bodily changes. So the human placental lactogen, HPL, because of 1000-fold rise in its level during pregnancy and its homology to the known insulin antagonist, the growth hormone. So we all know placenta will be secreting hormones during pregnancy, and HPL is a major hormone and it is homologous with the antagonist of the insulin, growth hormone. So because of its homology with the growth hormone, there is insulin resistance is more, so the patient will be affecting from the pregnant woman will be affected from diabetes. As the level of this hormone rises with advancing pregnancy, the insulin resistance worsens with time. So now we will move on to a patient who is suffering from gestational diabetes mellitus. So gender and age: female, 31, she is a married woman. BMI is 33. So here we have to note one thing: gestational diabetes mellitus 35 and the BMI will be about 30. So here we can note that the BMI is about 30 and pressure is 124/78 mmHg, and she was not a diabetic patient before her pregnancy, but one thing to note is that both her parents are diabetic patients. Next slide. Next slide. Next slide. Count. Next. Next slide. Sorry for the technical inconveniences. So how to diagnose gestational diabetes mellitus? To screen her, a 75-gram oral glucose tolerance test (OGTT) was performed. The results were the fasting glucose value was 106 mg per dl, and after 2 hours the value was 138 mg per dl. So according to the World Health Organization's value, she was suffering from gestational diabetes mellitus. But after that, her first pregnancy was terminated. It was due to several reasons, and one of the reasons is this diabetes mellitus, and it may be due to other complications which was in the baby and the health of an individual. So termination of the first pregnancy, but after some period of time the pregnancy terminated spontaneously in abortion at 10 weeks. 8 weeks after the abortion, again the glucose tolerance test was taken. It was repeated and her sugar levels was found to be normal. So she was advised to follow a normal diet and to undergo a GDM screening as soon as the next pregnancy is detected. So next, she was pregnant after some months. So she conceived again and underwent a 75-gram OGTT at a 6 weeks gestation. So eventually the fasting value was 108 mg per dl and 2-hour value was 210 mg per dl. So the result of glycated hemoglobin testing done at the same time was 6.6%. So it is above normal. So again she was suffering from gestational diabetes mellitus. Next slide. So what are the treatments and medications? So general pills will be given for diabetes mellitus like metformin and glucopride, but when we are suffering from gestational diabetes mellitus, we have to take care of the baby too. So insulin is the most accepted treatment for GDM. So insulin therapy in the form of twice daily injections of insulin aspart and once daily injection of insulin lispro was given. What are the follow-ups and observations? Follow-ups were done at intervals of 2 to 4 weeks depending on glycemic control achieved. Her average fasting and 2-hour plasma glucose values were 86 mg per dl and 118 mg per dl respectively. The insulin doses were increased with advancing pregnancy. At the end of pregnancy, the total insulin doses was 60 units and the weight gain during pregnancy was 12 kilograms. At 38 completed weeks, an elective cesarean section was planned. So here the baby, though there was no labor normal delivery, this C-section was planned. A live and healthy female baby was delivered weighing 2800 grams. The baby had an uncomplicated neonatal course. So one thing to note here that sometimes the baby will also get complications like hypoglycemia and overweight, and it will also get blood sugar levels. But here fortunately that baby did not get any complications. It was healthy and it was an uncomplicated neonatal course. So now everything is over, but after gestation, how is her blood sugar levels? The patient's plasma glucose values returned to normal after some days and insulin injections were stopped. She underwent a 75 gram oral glucose tolerance test at 6 weeks postpartum, which was normal. So the blood sugar levels were normal after her pregnancy. She was informed of her high risk of developing type 2 diabetes mellitus in her later stages of life, and she was advised to maintain a normal body weight by appropriate dietary modifications and regular physical activity. She was also advised to undergo oral glucose tolerance test every 3 years because she is having a risk of developing type 2 diabetes mellitus. Discussion and conclusion. The mechanism of gestational diabetes mellitus has not been understood properly till date because there is a big confusion about the exact cause, though we are saying that because of hormonal changes. It is at maximum in the third trimester, necessitating a threefold rise in maternal insulin output to maintain euglycemia. Mothers with deficient beta cell reserve become glucose intolerant at this time. So, gestational diabetes mellitus typically appears late in the second trimester or early in the third trimester. The goal is to manage blood glucose level by eating wisely, remaining physically active and following a proper diet. Thank you.
So, good afternoon everyone. My case study is on diabetes mellitus. It's a real one. And so diabetes mellitus, disorder of carbohydrate metabolism, is characterized by impaired ability of body to produce or respond to insulin and thereby maintain proper levels of sugar glucose in the blood. So, in the world, the latest data of 2021 says that around 537 million people adult have been living with diabetes now, and the data has been going to shoot around 643 million by the year 2030. So, here is the graphical representation of the countries which are in the leading race of diabetes mellitus. Though China is in the first place, but India is deemed as the world's capital of diabetes. Due to the population and sugar diabetic ratio in India, we are deemed to be the world capital of diabetes here. So, patient's profile, it's a completely real case study, and I have personally taken the data from the patient here. So, her name was Mrs. X, and the female gender, age of 49. She is married and she is an homemaker here. Height and weight ratio, and her BMI was around 15 kgs extra according to her height here. So, the factor of over obese also plays a role in diabetes mellitus here, and she is prone to an allergies of skin. So, diabetes case history, this is a case history where she has been diagnosed with, in 2012, she has been diagnosed for diabetes mellitus due to a skin allergy. She doesn't go hospital for any other symptoms of diabetes like body tiredness, swelling in bodies. She just went for a clinical assessment for skin and found with the diabetes mellitus during 2012. And this is the prolonged data and timeline where data has been collected throughout the years. And the recent data was collected on 2022. It was around 180 to 215 mg per dl. So, the physical assessment of the patient here was the inspection and palpation methods. Inspection was visually seeing them and observing their differences, and palpation is touching and feeling their skin tissues, etc. So, the skin was the first area to be covered, and skin was colored and tan with warm skin. It's normal. It's a normal process. Where the abnormal conditions where skin is black or greenish in colors. So, air has been inspected, and the air color is black and white. Where this white color has been considered as in relation to the age, it is considered to be normal here. And nails, pinkish nails, capillary refills 3 seconds upon balancing. So capillary refill here nothing but நம்ம கையை நெயில்ஸை வந்து அழுத்தி பிடிக்கிறோம் இல்லையா, அது within 3 secondsல திருப்பி அதோட ஓன் கலருக்கு வருதா அப்படின்ற ஸ்டேட்டஸ் தான். ஸோ அண்ட் ஸ்கல் அண்ட் ஃபேஸ் here inspection palpation method, no facial edema or no masses. There was no edema, which means எங்க வீக்கமோ or எந்த ஒரு ஸ்கின் ரேஷஸ் அந்த மாதிரி எதுவுமே இல்லைங்க. ஸோ vision eyes and vision, the eyes are aligned and short sight. She is having a short sight issue, but according to her relation to her age, we can consider it to be normal, not because of diabetes here. Ears have been in ears there was no tenderness and masses and clot, considered to be normal here, and nose in the same color of the face and can be between one nostril has been closed, so normal condition again here. So mouth, neck muscles and pulses have been considered, all the analysis have been considered to be normal here, and the pulse rate is normal on both the extremities. So this has been the graphical representation of the recent test taken by her in the April 2022, which says that she have 3 concern problems. One was cholesterol level and creatinine serum level, which was in the borderline here. So when considered to these 3 points, 2 of them are in border levels and one has been in a concern level. So glycated hemoglobin level was around 8.10%, where it should be below 5.7 for a normal individual here. And the cholesterol level was a bit higher for 20 mg here, but it is considered to be the borderline. And according to her BMI status, it can be considered normal here, since she has been around 50 kgs extra to her weight. So and creatinine level was comparatively lower here. It should be around 0.6 mg per dl. It was on 5.9. It's considered 0.1%. So it's also considered to be normal, and it's in the borderline syndrome. So doctor's medication for her was metformin 500 mg into 2 per day, glimepiride 1 mg into 2 per day, vitamin B complex 5 mg into 1, and calcium and vitamin usually given for women after 40 years was calcium and vitamin D. So it doesn't come under diabetes here. So the top 2 has been playing a role in diabetes mellitus, and usually metformin has been suggested for drug in diabetes mellitus. This metformin for her it is suggested around 1000 mg for a day, but metformin can be suggested 2000 mg for an individual who is suffering from a prolonged diabetes mellitus here. And diet chart, usually the doctor suggests around 1600 calories per day diet chart here, and she is following all this. But the most problem where arises here is the Indian diet chart doesn't allow us to follow on this 1600 calories chart. We are not stick to that. We will be exceeding some points here. So the allowed and the diabetic chart ratio was around 1600, which has the 15 grams of fat, 600 mg of calcium, 1000 mg of sodium, 250 grams of carbohydrate, and 40 to 50 grams of protein, 17 milligrams of iron here. And it shows that the timeline chart of the scheduled chart for diabetic patients diet chart. So to conclude with, the patient can improve her health status with ongoing treatments along with the physical exercise like walking and maintaining a proper diet here. It does not go to this particular person, but everyone of us should be healthier. Not only for her, since India is deemed to be the diabetic capital here, we all own that responsibility to stay physically fit here to avoid this kind of issues for us. Thank you.
So, case study on diabetes mellitus. So, what is diabetes mellitus? Diabetes mellitus is a chronic heterogeneous metabolic disorder with complex pathogenesis. It is characterized by elevated blood glucose levels or hyperglycemia, which results from abnormalities in either insulin secretion or insulin action or both. Next slide. So, diabetes occurrence and significance. About 422 million people are affected of type 2 diabetes, and about 1 in 10 adults around the world are currently living with diabetes. Third cause of death by diseases and the leading cause of new blindness in adults by aged 20 to 74. Next slide. So, common symptoms: tingling sensation. Type 2 diabetes can affect nerves in your hands and feet. Diabetes insipidus, frequent urination as kidneys tries to eliminate the excess sugar in blood. Increased appetite. As glucose metabolism is affected, you feel hungry even after you've eaten. Blurry vision. High blood sugar can make you have trouble focusing. Weight loss. The body starts to burn fat and muscle for energy, causing a reduction in body weight. Unhealed wounds and infections. It can be hard for your body to heal due to high blood sugar levels. Next slide. So this is a real case study of my friend's mom, and the patient's name is Catherine. Age is 42, sex female, weight is 64 kgs and height is 154 centimeter. Her BMI is around 23, which is in the border of overweight. And occupation, she is a software developer, so her job is mainly sitting and working. Medical history, she has acidity, hypertension and allergies. She has itchy skin from a very young age. Current diagnosis, type 2 diabetes mellitus, and current medication, Pantocid 40 for acidity and Zestrin. So the lab report of blood, here you can see the hemoglobin level is about 11.5 gram per deciliter, which is in the normal range. Plasma glucose fasting is 117.6 mg per deciliter, which is slightly higher than the normal range. And plasma glucose postprandial is 239, which is quite high. And blood urea 16.4 mg per deciliter, which is also in the normal range. Serum creatinine is 0.6 mg per deciliter, which is also in the normal range. Serum uric acid 3.3 mg per deciliter, which is quite above the normal range. Next slide. Lab report of serum, total cholesterol is around 176, which is quite in the normal range, but the triglycerides, which is 295, which is very quiet, that is below 150, higher than the normal range. And next slide. So the important factors we saw here, HbA1c, it's an important indicator of long-term glycemic control with the ability to reflect the cumulative glycemic history of the preceding 2 or 3 months. Analysis of glycated hemoglobin in blood provides evidence about an individual's average blood glucose levels during the previous 2 or 3 months, which is predicated half-life of red blood cells. The HbA1c is now recommended as a standard care for testing and monitoring diabetes, specifically the type 2 diabetes. Triglycerides are blood fats that are flexible source of energy. The body can convert triglycerides into glucose, and triglycerides can also be stored in adipose tissue or fat cells. The process of converting triglycerides into glucose is known as gluconeogenesis, and we know that in diabetes mellitus, the gluconeogenesis activity is increased and is performed by the liver. Increased gluconeogenesis is considered a major contributor to hyperglycemia in patients with diabetes mellitus. Lab report of urine, the color is pale yellow, normal. Transparency is clear, also normal. pH is 5.5, which is quite acidic, and SP gravity is 1.025, normal. Urine protein negative, glucose negative, urine bilirubin is negative, urine ketones random is negative, urobilinogen is normal, blood is negative, nitrate negative, leukocyte esterase negative, pus cells 2 to 4 is higher than the normal range. Epithelial cells 1 to 2 it's also in the normal range. RBC is nil. Cast and crystals are absent. The medicines prescribed were atorvastatin, given for those at high risk of abnormal lipid levels. Lipaglyn, it is used to treat diabetic dyslipidemia, hypertriglyceridemia. Jalra, it is used for treating diabetes along with diet and exercises. It prevents kidney damage and blindness. Rosuvastatin, it helps in lowering blood cholesterol levels. Glimepiride, it lowers blood sugar, causing the pancreas to produce insulin. Metformin, which results in a lessened sugar absorption and production and makes the body more sensitive to insulin. So the diet recommendations, the foods to avoid, the foods to eat. The foods to eat are whole grains, brown or wild rice, quinoa, millets and barley, fruits and vegetables, low glycemic fruits and vegetables like tomatoes, greens and cucumbers. Lean meat is preferred over poultry. Processed foods, avoid white bread, processed cereals, pasta, sweets, avoid sugary foods and delicacies. High glycemic fruits is watermelon, dry bananas and mangoes. References. Thank you.
Good afternoon everyone. I am going to present on case study on diabetes mellitus. Patient name is Steffi. She is an African American woman, age 38 years. She is 5 feet 7 inches tall and weight 235 pounds. BMI 36.9 kg. History she has a strong history of diabetes and coronary artery diseases on both sides of her family. A personal history of gestational diabetes with her last 2 children, and is employed as a legal secretary. Her blood glucose level of 213 mg per dl. Symptoms polydipsia, polyphagia and fatigue for the past month. Upon further assessment, she states that she has recently had his high glass prescription adjusted due to blurred vision. A diagnosis of diabetes is made and the patient is referred for fasting blood work, which reveals HbA1c 7.8%. Then fasting blood glucose is 137 mg per dl. 2-hour glucose level after 75 gram oral glucose tolerance test, 187 mg by dl. Triglycerides 178 mg by dl. LDL 131 mg by dl. HDL 21 mg by dl. Problem statement the physician refers patient to an ADA recognized diabetes education program. At her follow-up appointment, the patient's HbA1c has not significantly changed with a result of 7.7%. Estimated average glucose 174 mg per dl and a fasting blood glucose level of 172 mg by dl. SMBG records reveal fasting blood glucose levels consistently between 155 mg by dl and 190 mg by dl, and postprandial levels steadily between 190 mg by dl and 213 mg by dl. Patient claims to be adherent to her meal and exercise planning goals but is struggling with weight loss and hunger. Medications, as a result, her physician initiates her on TSD therapy. The patient is prescribed pioglitazone 15 mg each morning and she is advised to continue with her meal and exercise plans. Patient is also given instructions to report any signs of sudden weight gain, shortness of breath or chest pains, as these could be signs of excessive fluid retention related to TSD therapy. Patient has been adherent to her meal and exercise plan with little success and growing frustration. Her morning and postprandial blood glucose levels are above normal and both contribute to the elevated HbA1c levels. TSD therapy is indicated for patient because of her family history of coronary heart disease, obesity and suspected insulin resistance. Thank you.
Mr. Hodgson in case state diabetes. Mr. Hodgson diabetes patent, age 45 years, are suffering from diabetes since 5 years. He is ringing you this morning because she feels serious epitopics, pain associated with the report, vomiting and swimming. As the patent, 3 questions before the advising him. Remind about your treatment. Do you have any other diagnose, cheat, pain? Make random sugar and call me immediately. No diaries, random sugar. Mr. Austin have to be admitted to hospital immediately. Once there, let me the physician to call me. In the ER, the physician up to start history, checking visual scene, recommend to the nurse to talk the following: random sugar, BP 19/60, pulse 100 regular, temporary 37.5, ABG adrenal samples, IV route of take to thought venue samples, urine ECG. Work bed for random sugar, urine sugar and acetones, electrolytes, renewal functions, epitope function, CBC, serial tropones, HC, keratosis, enzymes, urine and blood cultures, ECG, guest radiology, UC bedside. DD, IG, DK, hypolysomia, ketones, acetoalbumin, acid, gastrorenals, others. Severity of the conditions: PO2, PCO2, O2 saturation, pH, HC3, emission gap, assimilotic states of the concentrations, PPD factors, MI, infection, stroke. The following patent data: random sugar 600 mg, urine sugars, acetones K 5.2 equaled pH 7.3, HCO3, horn in cap 16, astromolarity 300, caritone 1.2, CBC, lixtones 12, trypanones positive to analysis, ECG non-Q valve infections. Diagnostics MI, M plus DK sticks, HHC others. Admissions of ICU, CCU, monitor treatment of PPT conditions, cardiology, consolations and interventions, fielding resolutions, MI, CVP, electrostatis, insulin. Mr. Asana came out to have IHD interventions, fibrinolysis against hyperinogenations, and antiplanotis, hyperurgence, CVVO2. Explains expected complications. Coordination complication, MA, hypoglycemia, paranosis, decay, brain edema, thromboembolic renal fractures, ARD, centromics, hyperthermia. Hyperglycemia crisis, it's a presentable yes now pattern health education, important of diabetes care. Thank you.